I am Dr Padmini Prasad, gynecologist and sexual health consultant from Bangalore. Today I am here to give some awareness about a very common condition, that is polycystic ovarian disease or polycystic ovarian syndrome, very commonly known as PCOD or PCOS. Because this PCOD has become a household name these days. Because 1 in 5 women is really suffering from this polycystic ovarian syndrome. So everyone, when I see some girls or some ladies in their reproductive years, they just come to my clinic and they bring one scanning report. And when the scanning report says there is PCOD, they are so scared and they are so tensed up. They go to net and get all sorts of wrong information and they come here for treatment. This is very important to give awareness about this condition, which can prevent so much of anxious moments and also unnecessary misinformation about PCOS. Hetero Healthcare has started Vidhita to give awareness about all these conditions, to give awareness about the condition, to answer all your queries and also concerns regarding PCOS. So what is this PCOS? Every girl is familiar with this word, every woman is familiar with this word because it has become very common. So this polycystic ovarian disease is a group of symptoms or signs. That's why we call it as syndrome. And what are these symptoms? Very commonly the menstrual disturbances, either a reduced amount of bleeding or very heavy bleeding followed by amenorrhea, what we call it as absence of periods. Once in 2 months, once in 3 months, sometimes once in 6 months, even a year it can take. So that is the infrequent periods, and reduced amount of bleeding or heavy bleeding is one aspect. The other one is about in the reproductive years, the woman may come for infertility, that is not able to conceive. That is because of anovulation, in the medical terms what we call, there is a disturbance in the release of eggs from the ovary. The other important symptoms is some of the women or the lady girls can have increased hair growth in unwanted regions, like in the upper lips and the sides of the chin, and also hair fall, increased pimples in the face or acne, what we call. These are all symptoms. Sometimes they come with tiredness, weakness, and also increase in weight. Obesity becomes very common. A sudden increase in weight, menstrual disturbance, unable to conceive, weakness, tiredness, hirsutism, or what we say as increased hair growth in unwanted region. These are very common symptoms. So if you don't allow it to go to the late stage, we can avoid all these symptoms, we can treat it very early. So all these things can be controlled and treated, provided you come to the doctor, discuss with the doctor, not going to the internet and searching and then getting unnecessary information. So don't get scared unnecessarily. Of course, some of the investigations which the doctors advise is about some blood investigations and also hormone investigations along with the scanning of the uterus and ovaries. Because in the ovaries, that is where the egg is released. So that ovaries are filled with multiple fluid-filled sacs. That's what we call it as polycystic. That's why there are, because it is covered with a thick layer and also multiple cysts are present. Egg is not released regularly every month. So that will affect the growth of the inside layer of the uterus. That's why for so many days they may not have the periods, and suddenly they may start the periods, and for so many days the bleeding may not stop. All these things are disturbances. If it can be detected early, if it is treated well, there are also some long-term complications which can be controlled, because these girls are prone for, apart from the infertility, at a later stage sometimes a diabetic or some metabolic disorder, what we call. So that's why it is important to get it corrected at an early stage. So what are these causes? Why these days the PCOD is increasing? This is because of the altered lifestyle, their diet, the stress, and the imbalance between work life balance is disturbed, and their biological cycle is disturbed. All these things are leading to increased incidences of polycystic ovaries. That's why, what are the things which you can follow to avoid polycystic ovarian disease is: number one, your healthy lifestyle and a proper sleep of 7 hours, a proper diet with less of carbohydrate, more of fruits, vegetables, dal, and your plate should be full of all these things: raw vegetables, dals, and curries. And also exercise, at least a simple walking of about 20 minutes every day can help you. Jogging, cycling, swimming, skipping, any of this, at least you adopt some exercises in your work, and not sitting in one place and eating and all sorts of junk food and the chips and juices with lots of sugar inside. So once you adopt the healthy lifestyle with a proper diet, exercise, and if there are any early signs, go to the doctor early and get a treatment. There are various treatments available with the supplements and also medications to correct the disturbances. The main disturbance in this PCOD is increased amount of the male hormone testosterone, which is responsible for most of the symptoms. So that has to be controlled. And what the other thing is, what we say is insulin resistance. Because of the increased testosterone, there is insulin resistance, and glucose is not metabolized properly, insulin is not working properly. All these disturbances have to be corrected. So if it is corrected in the early stage, not much of problem, it can be controlled. And if proper treatment, menstrual disturbance can be corrected, and the infertility can be treated, and not to worry much. So if you have any queries, you can definitely contact the doctors, you can show the concern, and the Hetero Healthcare has started this Vidhita initiative to see that every woman becomes a healthy, happy woman. Thank you.